What is structural racism and how does it affect health equity? Imagine a world where your chances of getting good health care depend on your skin color or where you live. That's what structural racism creates in society. It's not just about individual acts of prejudice but about how entire systems work together to keep some groups at a disadvantage. Societies build laws, policies, and norms that favor certain racial groups over others. These systems shape who gets good jobs, quality education, safe housing, and yes, access to health care. When these systems are biased, they make it harder for marginalized groups to get the care they need. In healthcare, structural racism shows up in many ways. For example, some policies requiring strict identification to access services, which can be difficult for people with unstable housing or no official documents. Healthcare resources are often unevenly distributed, with neighborhoods of racialized groups having fewer clinics or specialists. Medical algorithms sometimes have biases that lead to misdiagnosis or inadequate treatment for people of color. These barriers mean that marginalized communities face higher rates of chronic illnesses like heart disease, diabetes, and cancer. They also experience higher maternal mortality rates, especially among Black women. Understanding how these systemic issues work is key to promoting health equity principles. It's about recognizing that health disparities are rooted in larger societal structures, not just individual choices. When we talk about accessible health, we need to see it as more than just opening clinics. It involves changing policies that create barriers and ensuring everyone can get culturally competent, respectful care. For people with disabilities from racialized backgrounds, these barriers can be even more complicated. They might face discrimination based on both race and disability, making it harder to find services that meet their needs. Addressing structural racism means looking at laws and practices that create inequality. We need to reform healthcare policies to remove biases, increase diversity among healthcare workers, and make sure services are inclusive for all. This includes improving social determinants of health like housing, education, and income, which directly impact health outcomes. When we focus on these changes, we move closer to a healthcare system where everyone has a fair shot at good health. Recognizing the role of systemic racism helps us build a future where health equity principles guide us toward fair, accessible, and inclusive medical services for every individual.